Thank you, Dr. Abhishek. Thank you, Hindi team. Thank you, everyone. Now we are moving to our English session. Today is our 2144th day of continuous webinar. Thank you all the participants for joining with us. Before beginning the session, we'll have a silent prayer. Good evening and welcome everyone. Today is our 2144th day of continuous webinar. Today's our speaker is Dr. ROHIT SRIVATSAN, and he's successfully running Victory Homeo Clinic, and he's the medical director of the Homeopathic Research Homeopathic Research Foundation. And Dr. Rohit is a good counselor and good prescriber, especially for children. And he's selecting the remedy with the temperament of the children. And he is invited by Dell Software for to take the role of homeopathy in the stress management. And he presented papers in international and national seminars in many places, in many subjects like temperament, about nurturing child, and presented papers on gallstones, fibroadenoma, and he successfully treated many cases of ADHD, autism, delayed speech, bedwetting, and now also he is continuing his journey successfully. Actually, we are so happy to get you as a speaker of today. Dr. Rohit Srivatsan, you are welcome. Please, you can start. You can share the slides. Okay.
Yes. So, good evening to everyone. And I would like to thank IFPH for giving me this opportunity again for presenting one of my paper. I am Dr. ROHIT Srivatsan, a consulting doctor at Victory Homeo Specialty Clinic in Bangalore. Now, I've been practicing in my clinic from the last 15 years now. It's one of the oldest clinics in Bangalore, and I've been having in fact, I've presented a lot of papers earlier in the same platform on fibroadenomas and temperaments and other topics in the past. Now, today I've selected my topic on gallstones. So, gallstone, why I have worked, basically over the years, I've worked a lot on this specific topic. Now, initially, when I graduated, I started practicing with my father, Dr. Srivatsan, and then started understanding how homeopathy and started working on these lines. Now, gallstones, and generally, I had an inclination for the surgical diseases. And I did work in the college also as a lecturer for about 5 years in Bhagwan Buddha as well, uh, initially, after graduation and all that. Over there, I was in the department of surgery. So slowly, I started having an inclination for treating these conditions. So under homeopathy, in our organ of medicine, we all know about classification of diseases and all that. So under the surgery cases, so I always had this thing, why not try to work on specifically the cholelithiasis conditions if we can. So there are so many studies our Metra Medica, which speaks about gallstones, speaks about colic related medicines. And over the years, through experience, when I've started prescribing medicines, I would say I've been all the time 100% accurate and I've been able to achieve success in all my cases before I start the topic. But there are cases which has helped maybe because the problem in treating these gallstone, now as soon as you hear gallstone, people speak about surgeries first thing. I would always say my patients, please don't worry. I understand surgery can be an ultimatum, but it is never an emergency. It is a planned surgery. This is very important because as soon as a scan is got, today everyone is so used to getting blood tests done, scans done, annual scans for insurance, for all kinds of purpose. So as soon as they hear the word gallstone, the doctor who they would consult would immediately tell, you get it operated. Come, I'll get it operated tomorrow. Come and get admitted. It's not like that. This is never an emergency. Because as a general protocol treatment for this, because there's no other treatment. So they remove the gallbladder completely. So they would be doing a surgery to removal of the gallbladder. Cholecystectomy is the choice of operation. Here in homeopathy, we have medicines to treat. We have action of our medicines on the gallbladder, on the liver, to work on the lipids for the functioning. So we can treat this accordingly. So when I started working on different types of medicines, now, like I said, this belongs to the classification of surgical one-sided diseases because gallstone is asymptomatic. 99% of cases which we treat in our clinics are 99% is asymptomatic. Patient doesn't have any symptom. One, it is accidental finding. Second, third, the patient will start assuming that he's getting symptoms, but he would have had a simple dyspepsia, which has got nothing to do with the gallstone. Gallstone pain doesn't come in the abdomen. Gallstone pain, gallstone colic is completely different. Yes, why they talk about surgeries? If the stone gets moved, it gets blocked in the bile duct, only then it becomes important because patient can end up with cholecystitis or it can move into the pancreas and cause acute pancreatitis, and that becomes an emergency condition. To avoid all that, surgery is thought of. But let's try to understand how we can tackle these conditions. Now, our objectives in today's lecture will be try to understand there are two types of gallstones. One multiple stones, or it would be a single large stones, majority of the times. Now, the sign, and in this study, we will be reading about signs and symptoms. So, to understand the metabolic cause, the ratio between the bile salts and the cholesterol reduces, and this cholesterol precipitates, and this leads to a single solitary stone. And these cases which you see in an ultrasound scan, or the number of cases you would see is less. Generally, you would see a mixed multiple stones. So commonly in your ultrasound scan, we would generally see multiple stones, small size stones. Few cases you will see single large stones. So this is the general outlook which you would see in an ultrasound scan. And how does this happen? Infection. So patient would have developed an infection in the past, and that bacteria enters through the bloodstream, enters into the gallbladder, gets fixated there, then cholesterol deposit and the bile precipitates over it, and then it forms into a mixed stone. Another important factor is pregnancy time. Many a times we see this. A lot of pregnant ladies get diagnosed with gallstone during that time. They neither can plan for a surgery at that time. They can't even take strong medications, but our medicines are safe, so we can help them to handle this condition very nicely. And many other time also we all know gallstones are very common in females. Also, important is this theory during pregnancy is many a times because of the in pregnancy, we know progesterone takes over, estrogen reduces. In that theory, again, there is no specific scientific theory to hold good why that happens during that time. So all these factors gives us information how we can understand gallstones, how we can treat them. First, we need to understand the pathology behind it. What is the reason why this is happening? Increased breakdown of RBCs, bilirubin is increased, and that results in calcium bilirubinate stones or pigment stones. That again, 5 to 10% of cases, we would see these types of gallstones. So most of the cases which get diagnosed are mixed stones, which is 80% of the cases. Let's move forward. Now, the risk factors involved in gallstones, it is most common in females who are again obese. Obesity is very common, maturity onset diabetes, and age more than 40 years. So this is something which is very common risk factors that we would see in most of the cases who end up with gallstones. Investigations. Now, this is very, very important. Now, as doctors, and generally homeopaths, which I want to stress on, it's very important that we need to know everything. We should be all rounders. We should have a knowledge of everything. Like how our organ says knowledge of disease. So you should have knowledge of disease, knowledge of medicine, your Metra Medica repertory, and medicine with investigation, this helps. Now, by knowing this, now many a times the patient would say, Doctor, they're forcing me to get operated tomorrow. So what can you do? Now, end of the day, you want to treat that patient. How would you convince a patient? How would you convince anyone who has just got diagnosed with gallbladder or who is suffering from gallbladder? When you do a liver function test, now these are the parameters that you would see. Something called as SGOT, SGPT, ALP, the bilirubin, then you would see albumin level, then GGT level. Now, very important in this liver function test is in a gallstone condition, if the stone has moved or if the stone is causing a blockage in the common bile duct, then the ALP level increases, alkaline phosphatase level increases. Then another important titer for us to check is the GGT level. Again, bile duct related problems. Now, this is very important. We need to understand because we are treating the condition of gallbladder. Gallbladder, what is gallbladder? Gallbladder is just a storage gland. It stores the most important, I forgot to mention this very important case is when you're going to treat the case of a gallbladder, more than anything, more than our medicine, more than any other thing that you will plan to prescribe, you need to make sure that the patient eats at the right time, at the right quantity. And that is the reason it is very common in females because ladies in the house or at work, they eat breakfast after everyone eat, or they skip their breakfast or they go to office and eat, which is late by the time they wake up or the time their breakfast is. In a hurry, they would eat less, or sometimes skipping meal is a very common thing for a lady. That is another reason why that is a risk factor. Now, why am I stressing this? Gallbladder is a storage gland to store bile, which the liver produces, and that is used for our digestion of protein and fat by the intestines. If we don't eat at the right time, at the right quantity, the bile remains inside the gallbladder and it's not moved out. There is bile stasis, and that is one of the main reasons for the stone, for the bile to precipitate and to form into a stone. So this is very important when you're going to treat a case of gallstone. Try to understand the lifestyle of a person. Do they eat? What do they eat? How much are they eating? And keep up the time. This is very, very important. You keep giving medicine, patient doesn't eat properly, the stone can keep increasing. I'll explain the diet also later on. Now, like I was explaining, the liver function test helps us to understand this. So ALP level and GGT level helps us to understand diseases related to gallstone. So gallstone cases will have increase in this. So if the values are normal, you can tell the patient everything is fine. Your liver is functioning fine. Your gallbladder is functioning fine. Why are you worried about the stone? In fact, there are so many patients also, or so many in general people who have gallstones for years together, 10 years, 15 years, no problem. But there are people who get to know about gallstones and they become hypochondriac. They start showing symptoms of gallstones unnecessarily, thinking that, oh, I have stone, I have stone, I have stone. So this is important. So there are two kinds of people. One who are not bothered with years together. One, as soon as they come to know something, they start imagining. Or anxiety of the doctor. The doctor will try to feed something as soon as they come to know about it. Surgery, surgery. It comes into their mind. And very important, today everyone has insurance. You have insurance, go for surgery. Why? The God has given you an organ. Otherwise, we would have never had a gallbladder. Why should we have a gallbladder? Try. I would always tell patients, please try. If you're going to show us success, if the stone reduces, let's go ahead. And most of the time, with the type of medicines that we have, we can do it. If we get a good similimum, that's the best thing which can happen. But if we don't, still keep trying. What do we do in one-sided cases? What do we do in surgical cases? Take whatever totality you have, prescribe. Or prescribe with the help of therapeutics, because some of our medicines have a specific sphere of action on the gallbladder. Select that medicine, prescribe. And then keep using the investigation, keep doing scans. An ultrasound scan is sufficient. Then lipid profile. Now this is very important to understand lipid profile. Now why am I stressing about this is because this is what is important when we treat cases. Because this is the information which the patient has. This is the information which you can also make the patient understand when you treat whether thing is going in right direction or not. Patient will not understand the name of the medicine or what medicine you're giving, what dosage you're giving, how what is the potency you're giving. That will not have any relevance to them. Their relevance is investigation. That's why I'm tricking on this slide so much. HDL, which is your good cholesterol, LDL, your bad cholesterol, triglyceride, and LDL, HDL put together is your total cholesterol. Now your lipids have to be under control. So now main restriction for your gallstone is try to make sure that you eat healthy food and less fat. This is very important. Now, another thing over here is the values of HDL has to be 35 to 45 range, which is anything above 45 is good. LDL, commonly majority of the laboratories, they speak about LDL less than 130 or it has to be less than 100. A triglyceride should be less than 150. Now, triglyceride basically for the arteries. LDL is your bad cholesterol, which can add to cholesterol. So try to make sure that you keep these tighter values better. What can you give? We have so many medicines in our homeopathic science to treat these lipid profile. Give them. Make sure that the values are taken care. Explain the patient if they're eating anything particular. Now, how do you handle this? LDL, what is LDL? What is that bad cholesterol the patient eats? Protein related food, animal sources, so dairy related sources, fat which comes through milk, curd, cheese, paneer, ghee, butter, all this is LDL. LDL is more, tell the patient to make sure that they start doing this. If they're drinking or using milk which is high fat, tell them to cut down, use a very basic low fat milk. Automatically 50% of the problem is solved. Or if they're eating too much of non-veg, tell them to cut it down a little. Triglyceride, it is basically oil which is coming from a cooking oil. Try to explain the patient that they need to use oils in a moderate way and try to see if they've been not using the right kind of oil or right quality of oil. It helps. Now, everyone, when you see the history of oils or whatever researchers are done on oil, it would say olive oil is the best, but not everyone can have olive oil in their cooking. It's very expensive. Then you have nowadays you have cold pressed oil, you have wood pressed oil, you have refined oils, you have sunflower, groundnut oil, what not. There's so many different kinds of oil nowadays. Coconut oil. Now, many a times we see coconut oil which increases the triglyceride, but it helps in conversion of LDL. So many a times we've seen this. I have observed this many patients in coastal side, which they're accustomed to using coconut oil for their preparation. So many of them have elevated triglyceride values. When I tell them to try to moderately work on it, it helps. It gets corrected. Their HDL will be perfect, but the triglyceride is increased. For all this, there are medicines. I'll explain you what medicines can be given later on. So we can correct the body by not forming or increasing the stone by knowing the investigating values of what is more and what is less and try to correct it with our medicines. Clinical features. Now, like I was explaining, the pain has got nothing to do in our abdomen. So there is no much pain in the stomach, umbilical area, low abdomen, nothing. But patient, as soon as they come to know, they'll start saying, I have pain, I have pain. The gallstone, typical clinical symptom of a pain would be back of the liver, that is where it is anatomically located, the gallbladder, and it radiates and shoots between the shoulder blade, that is the right scapular area, goes up to the right shoulder, and there is a pulling pain, which is very important. And if it is a case of stone leading into cholecystitis, then Murphy's sign has to be positive. That is how you can even correct the patient, or you can tell whether you require a surgery or not. Do the physical examination for Murphy's sign. Place your arm, your palm on the patient's liver at the right hypochondriac region. Ask the patient to take a deep breath and release. If the patient is eliciting positive Murphy sign, then he will have a lot of pain and tenderness. If not, no. There only you can rule out that the stone is there, but it is not showing any inflammation. Then, mild to severe kind of pain and aggravation is at night, and patient can show symptoms of indigestion, nausea, gas, excessive amount of gas, and vomiting. Now, again, very important, like when we treat or when we understand abdominal condition or GI conditions, we all have read or known that, uh, for example, pancreatitis is very severe, appendicitis is severe, but appendicitis has to have fever and vomiting along with it. The location is very important. Likewise, even in gallstone colic, the location of pain is very important. You just cannot, you see, that's how you make the patient understand whether it is required, surgery needed, not needed, how you can treat and accordingly. Even peritonitis, for example, peritonitis is very severe. So let's try to understand and treat the patient accordingly. And many a times the patient might be suffering from a very simple condition of dyspepsia, or the most chronic which every other person today suffers from is GERD, gastroesophageal reflux disease, which is nothing but sour eructations, heartburn, pain. So these are the common DDs. Why am I stressing all these conditions? These are DDs, differential diagnosis for this condition. So when patients commonly have this problem, but as soon as they get a scan, they'll think it is the stone which is causing this problem. No, stone is never causing this problem. Many a times, even if you don't treat, the stone might remain the same size, or maybe there's a marginal increase because the stone would have formed over the years, over months, and this is a chronic condition. Now, when I'm going to treat this condition, it is not going to reduce immediately. I mean, at least out of my experience, what I'm saying, which I treat, it takes months together for the stones to decrease or clear. This is the need to make the patient understand that no, this is not going to be something like a kidney stone. Now, kidney stone is an acute condition, and kidney stones can pass out. There's an outlet. The stone can get flushed out through urine. But here, very important in treating gallstone is the stone should not pass out. The stone moves to the common bile duct, CBD. The patient will have blockage. There will be inflammation. There it can lead to pancreatitis. It can lead to cholecystitis, all the others related problems. So repetitive scans, very important to constantly keep checking the wall thickness of gallbladder, distension of gallbladder, and to check whether the bile duct, common bile duct is free. That is very, very important. If all these factors, criteria are very important, and constant investigations are important because most of the cases are asymptomatic. Now, diet. Very important. Like I always tell my patients, uh, now they ask me what all I have should not eat. Now I have purposefully put a big chart here, but in fact, in my clinic, I say nothing much. There are only three things which I would inform them: fatty food, fried, that is nothing but oily fried food, and alcohol. Now, most important over here is, unlike a kidney stone, there is a big list of things which, what happens as soon as they hear the stone, a common man, I don't deny their apprehensiveness or their anxiety. Or it's a layman thing that as soon as they hear stone, they will think there are so many things. I have to drink tender coconut, I should drink lots of water. No, that has got nothing to do with gallbladder. That has all got to do with kidney. So we need to make the patient understand that this is a different organ, this is a different type of problem, this is a different condition. The formation of stone is different. The reason for formation of stone is different. Stone has to reduce by itself. You will not have any symptom when the stone reduces or when the stone increases. Unlike a kidney stone where you will have fever, urine infections, or you can see blood and other symptoms if it increases, or basically renal colic. So very important is highlight would be the fat and fatty food and oily food. Basically, try to make sure that your cholesterol values are taken care better. That's the main thing which you need to guide the patient over here. Junk food. Try to avoid fast food and junk food because today with Instagram and Facebook, every other person puts a reel, shoots a video on their mobile, and they have become influencers, food bloggers. And today it's a very big thing that people go in search of places to eat, and whoever makes the most fancy food. What is fancy? Put almost so much of butter, oil, cheese, paneer into everything. Mix, mirch, masala, everything put together, spice, and that has become the speciality of today. So now in Bangalore, Bangalore. We all know it's famous for masala dosa. So they put ghee, so much of ghee. The dosa will be floating in ghee. What would happen if the person would start eating these kind of dosas regularly? And they take the photo and they have a thing that every weekend they want to visit these kind of places who are having so much of rich food. Ultimately, you have issues with your lipids, your liver takes a strain, you will end up with gallbladder stones eventually. So this is where it is important. And Chinese food, you will end up with kidney stones because they put the salt and all that in it. So we need to make the patient understand what you're trying to do, what is your lifestyle. Eating outside is fine, but need to understand once in a while, okay, for fun, for the enjoyment, it's good. Now, homeopathic, I've already explained a few things. Now, constitution, like I was explaining, constitutional medicine, if you get it, is the best thing which you can do. But again, it all depends on the case taking. Now, I run a very busy practice here in Bangalore. So, number of hours that I consult to the number of patients that I meet, so the equation between patient time to the doctor's time and how much the patient is going to be so regular in taking so specific and the do's and don'ts and the right dosages, all these plays a major factor. But whatever best we can try to do it, try to extract the best information. Like I always say in my previous presentations, I have had a knack of presenting or capturing the patients through temperaments. I have that, and I have some easy ways in which I can try to understand the patient's mind, his generals, and try to get a nearby similima. But if I don't, try to take whatever totality you can. Even a simple three-legged stool is enough. Some three important symptoms are important. I mean, the general symptoms. It could be mental, it could be physical, or it could be anything characteristic related to the particular symptoms also is important. Try to take whatever is available, treat the patient. End of the day, the patient is coming so that homeopathy, there is a choice. So let's try to see what best we can do about it. It has to be, our remedy selection has to be based on totality, causative factors. I already explained whether the classification is acute or chronic. Acute, why I've mentioned acute over here is if the stone is causing a cholecystitis condition, still you can still treat this condition. There is no emergency unless the patient's symptoms are very, very severe. Treat with our medicines, our mother tinctures. They have so many mother tinctures with us, which have a superb action on gallbladder and liver. We can take the case under control, do scans every week, observe. This in once the inflammation is settled, start treating on the stone again and again. We can do that. Then constitutional type, miasmatic background, and of course the temperaments. So we need to take care of all these things. Now here I have presented a case where two cases I am presenting here where I've got a nearby simillimum, I have used some other tinctures. I've done what best we can because homeopathy, there are different ways in which homeopathy is practiced. There is no one way. Had it been only one single way of practicing homeopathy, it would have been very easy for our science. But everyone, our book is so nice that there's never been anything that you have to do it like this, you have to give this. There is no do's and don'ts. Treat the patient, try to give a single medicine at that time, and then see what best you can do. Had there been no use of mother teacher would have never been used in a practice at all. If we would have got a simulum for everything. Now there are only few, there are quite a few medicines which are polycrest. So whenever you do totality, you get only those medicines. What about the small medicines which have been entered into our Metramedicas, who have been lesser known, but they also have specific actions. I'll share a few medicines of them as well, which I use in my practice. Now, coming to the therapeutics. Now, like I said, polycrest medicines, very good. That's why I've written therapeutics is basically sphere of action. Medicines which have a specific sphere of action. Now here, calcarea carb, chelidonium, feltori, lycopodium, leptandra and cholesterol. Now chelidonium, feltori, lycopodium, calcarea, all these have an action on liver, gallbladder. Now chelidonium, feltori, everyone knows about feltori. It's a very less proved drug, but it has been mentioned very clearly for gallstone colic or right hypochondriac related pain, vomiting, distension of abdomen. For all those related symptoms, feltori works well. The same feltori can be worked for a stone. So when it's having an action on a specific which can take care of a pain which is arising because of a gallstone colic, it still holds good. It has a good sphere of action. Lycopodium, obesity, female, it is very specific action on liver, gallbladder, colic, many a times distension of abdomen, gas, flatulence. For all these related symptoms, again, lycopodium holds good. Chelidonium, right-sided remedy. Gouty diathesis. Again, it is very specific for gallbladder or liver in general. We have used them in so many cases of enlarged liver, hepatitis condition, fatty degenerative changes. So all these medicines have an action. Now, leptandra is another medicine. Over the years, I have started using this medicine, not only for gallbladder stones, but it is a medicine which I use very commonly in GRD conditions. Not only in GID conditions, I even use it in few liver related problems. Apart from that, I have also used this specific medicine in gastric erosion conditions or gastritic related problems, even in few cases where there have been suspects of gastric ulcer also, that is peptic ulcer related. Now, this leptandra is a medicine. It shows symptoms related to gallstone colic, vomiting, bile, eructations, dyspepsia, heartburn. All these are there. Now, one thing we need to understand in our Metra Medica, we don't have anything specific as cholelithiasis medicine, gallstone medicine, pancreatitis medicine. No. When you open the whole of Metra Medica and you put appendicitis, there is only two medicines it will say specifically the word appendix. That is iris tenax or iris worm. But there are other medicines like colchicum, belladonna, bryonia. There's so many other medicines. Likewise, our medicines has like for gallstone. So when you open a book, you will never get medicines for gallstone. Now, I have written a few mother tinctures here. Berberis vulgaris, Cardosmar, Chionanthus, Calmeg is nothing but Andrographis, Guatteria gumeri, Boldo. Now, when you read any of these these mother tinctures, no way it says specific for gallstone treatment, nothing like that. Yes, it says gallstone in Berberis vulgaris. It says gallstone for Chionanthus virginia. These two mother tinctures, there is only a word in our Metra Medica. When you open Clark's Metra Medica, or it could be even in Boric, there are very few medicines. It would say chelidonium, it would say feltori, Berberis vulgaris, Chionanthus. But any medicine can work if it is a symbilimum with a polycrest or anything for that matter, with total repertorization and everything. But when you're going to treat just related with the symptoms or what medicines we have in hand, you will have only this information. Our Metra Medica will only speak about enlarged liver, jaundice, bile stasis, distension, eructations, black stool, yellow urine, only those symptoms, which you will never see in the symptom because the patient is asymptomatic. Try to use the medicine with its sphere of action. Now, Berberis vulgaris has a specific sphere of action of gallbladder. Chionanthus has a specific sphere of action of gallbladder. Use those medicines, treat. Now, in this specific gallstone, I have used my prescriptions in a different way. You'll have to pardon me on that. But my earlier cases and few cases, I do with similimum, one medicine at a time, but sometimes with stone cases, I use mother tinctures. Now, this is a case of Mr. George, who's a retired government employee. Now, this is an old case. Had pain in the abdomen. Uh, Patient has not been eating at regular timing. There was a marriage at the home, and then so he was busy with the relatives, with the arrangements and all that. There was a lot of outside food, rich masala food, and all that. So at that time, just after marriage, he went for a scan and he came with a report of gallstone. And this scan, I'll explain the scan later on. So the patient expressed pain at the right hypochondrium, at the region of the epigastrium. There was dull aching pain in the right hypochondrium, burning sensation in the epigastrium. There was acid reflux, regurgitation of the food which was felt by the patient. The modalities over here, the patient was expressing his pain after eating food, evening and night. So this was something which was important where the patient was expressing after lunch towards evening is when I used to get the discomfort. Again, night after the dinner, I would get it. Breakfast after, still he was still okay. But generally after lunch and night dinner, this was the time when he had more pain and gas, flatulence, right hypochondriac pain, burning, typical symptoms of GRD also, which was very evident in the patient. These symptoms have been with the patient in the past as well, but these symptoms have become more ever since uh, the function and all that has happened. So he went for a scan, and okay, I'll complete the physical generals. The patient has his bowels, which is a little slightly constipated, 1 to 2 times. He has an urge to pass motion after eating. This happens to him generally even after breakfast. He would have a urge or some 1 to 2 times. One after he wakes up, the other one would be either after breakfast or after lunch. Urination 4 times, 1 time in the night. Desire for sweets, which was a little marked for him. Perspiration was normal, thermals hot. Alcohol, again, he's not an alcoholic kind of a person. Like to enjoy a drink, keep it simple at home. So about 2 to 3 times in a week. So this was his general information which I could gather. With his mental general, he was anger prone, short lived, censorious. So he was a little sarcastic, or uh, he is a little critical in nature. So whenever, if in fact, he had come with his wife and daughter when he came to the clinic. So so they were mentioning, or when they were conversing, so he would try to stop them, or he would try to snap at them. He would try to, be a little sarcastic. So it's kind of that hard to please. So they would say he gets irritated very easily. Uh, Though I give him food in the right time, he gets angry that this is not proper, that is not proper. So so that is what his wife was saying. I tell him to eat at the right time or do this. Now that he's retired, he sits with his newspaper for a long time. Then sometimes he goes for walks, he comes back late. So all these are small, small things which have changed in his life. And contradiction, aggravation. So these are small things which I could get in this case. Now, again, like I said, in this case, I could gather some information. Because nowadays, most of the cases they come through email, it comes on WhatsApp, they send the scan and they say, doctor, send medicines through courier, I will take it. No case taking. Patient is so busy, they don't even want to tell anything. Doctor, I have no symptom. Gas, thoda bahut upar niche, gas, that's all. They don't want to say anything much. Everything is so fast today in life. So this was a scan which the patient complained of 6 to 10 mm stone which was seen, and the wall was slightly thickened, so that indicated slight cholecystitis condition which was very mild. And so yeah, so this was the thing. Murphy's sign was positive, which was also done at the center, and I also elicited that. So the pain, dull, aching type in the abdomen, eructations, desire sweets, pain, dull aching type, right hypochondrium, evening, nights. So these were all the rubrics which was taken. Contradiction, intolerant of mind, anger. So all these were other symptoms which was uh, taken into the totality. So further repertorization was done. Lycopodium, sulfur, Naxomica, sepia, Moxol, Bryonia, these showed higher covering of the rubrics, which high scorings of Lycopodium, which was very marked. So Lycopodium was selected as a choice of prescription. So Lycopodium was the Simlimum which I have selected. And along with that, Chionanthus as a mother tincture was prescribed. Now, like I said, you'll have to pardon me. There are, look, as clinicians, as doctors, maybe it is think that I could wait only with Lycopodium and see how it goes across. But end of the day, result is also important for me. I need to show things faster. And this is a chronic condition. So things go, it's again, like I said, I need to make the patient understand it's not going to happen in few days, few weeks. It takes its own due course of time. But there's nothing, there's no harm. So there's no hard and fast rule in which we have to prescribe. So when I gave the medicine, I gave the medicine and then started mother tincture. So mother tincture was prescribed 7 days later. So when I was prescribing Lycopodium, it was only Lycopodium, after which the like mother tincture was introduced. Then Chionanthus mother tincture was given. Then again, there was a follow-up with the patient. The patient had a small loose motion, which he had for about 3 days. And then I went to the next power of Lycopodium 1M. Then again, Chionanthus was continued. Patient generally was better. There was no much bloating. He was doing all okay. Lycopodium 10M was prescribed, and then Chionanthus was continued again. Now, this was the last scan. Again, this was again after about close to about 8 to 9 months after. So the stone is cleared right now, and the wall thickness is also normal. There is no distension, no problem. So, like I said, so this cases when we treat now, this was this earlier case one was a multiple stone. So we need to make sure that we can see what best we can do with in hand and treat accordingly. I've also used a few medicines. Like I have written medicines of mother tinctures like Gaulteria gomeri. Now, this is a mother tincture which I've been using from the last 10 years now. I mean, yeah, almost since about a decade right now. Now, that medicine I generally use for cases not only for gallstone, any case of hyperlipidemia, and specifically triglyceride. All my cases, when I treat for cholesterol related problems, basically only triglyceride. Elevated triglyceride, it comes down with Gaulteria gomeri. Cholesterinum, it could be 6x, 12x, 3x, whatever it is. Cholesterinum 6x is what I use generally. LDL comes down. This is out of my experience. Triglyceride, Gaulteria gomeri, LDL, cholesterinum. So using these medicines with our current prescription, the lipids come under control, formation of stone is taken care better, fatty liver gets better because nowadays we see, I forgot to stress on this point. Nowadays we see so many cases of fatty liver. We are Indians, खाते पीते लोग हैं हम लोग. So have we have a tummy. Now Indians generally have a good tummy. Fatty liver is a very common problem. Now grade 1, grade 2, grade 3. Now grade 1, grade 2 still okay. Grade 3 a problem. Grade 1, what symptoms you would get? You don't get much symptoms of fatty liver. You just get bloating. That's the only major symptom, or gas. Now, we need to understand this fatty liver has a direct correlation on gallstones. Now, increase in fatty liver over the time can lead to formation of bile stasis or increase in bilirubin and variation in the cholesterol values and leading to stone formation in the gallbladder. So most of the cases, now we need to keep a check. Next time when you keep seeing ultrasound scans, try to give her medicines. Now, what do you give for fatty liver? There are so many wonderful medicines. Give chelidonium, give cardosmar. They control our cholesterol 6x. They help treat the fatty liver so that further future formation of stones will not happen. Now, this is the next case of Sanjana. She's a HR in a multinational company. Though she had complaints of bloating in the abdomen, patient has not been having food on regular timings. Like I was telling, this is common in ladies. Now, not eating at the right time, used to do intermittent fasting, obese, sedentary lifestyle. Now, many a times we see ladies doing fasting a lot. They do keto fasting, intermittent fasting, only fluid fasting, fruit fast, only with food, only with fruits, or sometimes they go to uh, one meal a day fasting. There's so many ways in which people try to make sure that they reduce weight. But in return, if they do this too much, too regularly, and not take care of their vitamins, and one important thing I forgot is today's generation is speaking only about protein. So, doctor, how much protein I need to have? Doctor, and everyone goes to the gym, and that gym instructor, I want to catch all the gym instructors one day and give them a lesson about everything. Today, we are seeing so many cases of indigestion, piles, fissures, only because of gym instructors. Because they tell them to eat protein, high protein food. And patients end up eating 2, 3, 4 eggs every day. And they don't eat proper vegetables. They'll end up with constipation, indigestion. What will happen to all those kind of things? So it creates a lot of imbalance in your digestive system and working for different timings. Now, many people work for American timings, European timings. So their food lifestyle changes every 15 days, different shift. So all this causes problem in their liver, leading to stone formations eventually. Location, right and left hypochondrium, epigastrium, distension in abdomen, burning pain in the epigastrium, sour eructations. So all these are the symptoms of after eating food. These are all very simple symptoms. Again, modality, anyone who would have acidity has pain after eating food. Then physical generals, constipation, unsatisfied again, and then thirst is less. They advised her to drink a little more water because that is another problem of Bangaloreans. Since I work in Bangalore, the weather is perfect, neither too hot, neither too cold. If it gets hot, it starts raining. So you people generally don't drink because you don't sweat. And there's so much of greenery, so there's no much sunlight and everything is cool and breezy and nice weather. So that is another problem. So make sure we always tell them to drink more water. Thermals chilly. So mental general, sympathetic in nature. She was very affectionate. She came with her daughter. I'm treating her daughter also. She's suffering from PCOD. So she has irregular cycles. So, when they converse, we can understand ha beta, how do you speak? There's a small, nice way in which she tries to speak to her daughter. We can understand that. She's a very mild, polite kind of a person. She very soft spoken. And she had this fear of surgery. Why she came to me, fear of surgery. Again, I wouldn't say it's very marked. Anyone was scared of surgery. But there are few medicines which cover this rubric. So this was also selected. Pain, dull, aching abdomen, burning, thermal chilly, sympathetic, affectionate. She was a little talkative, so loquacity was the rubric taken. Fear of disease, mind. So all this after repertorization, phosphorus was taken as the choice of medicine. Phosphorus, Naxomica, keeping her mild composed nature. So I selected that, loquacity and all that. So here I have used this medicine in different ways. Now here, like I said, the prescription for phosphorus, okay, but not wow. So that's the reason I had to give another few medicines in choice. Now she had the dyspepsia symptoms. Now for that particular reason. So she had that pain, sour eructation, acidic. Her lifestyle, her food habits is causing that problem. It's not the stone. So for that, Leptandra was given. Why Leptandra? Because it has an action on liver, bile, and acidity, dyspepsia. Everything covers in that. That was given for that reason. Chionanthus and Gaulteria gomeri. Sorry, I've misplaced the file of her lipid profile. Her triglycerides was about around 200 or 250 odd range. So that is the reason why I have used Gautier Gumeri as a prescription in this case so that her lipids come under control parallelly while I'm treating the case. So for the distension of abdomen is better. Now I have used Naxomica since she was saying that slight distension, gas, bowels, again still not okay. So I prescribed Naxomica as a medicine. Her cholesterol levels were declining after the prescription of Gautier Gumeri. Her triglyceride came better. Then further continuation of the mother tincture, further follow-ups, her cholesterol values became normal. Her gallstone size have reduced to 3 to 4 mm, and by the end of the following month, the gallstone was cleared. So initially the patient came with a size of 22 mm. Then that was almost in the month of February. Then in the month of September, so after about 6 months down the line, the size had come down to 4 mm. And then again after 1.5 months, a further scan was done, and then there was no stone which was seen. So there was a large single stone, which later on there was 3 to 4 mm stone calculi. Maybe it had broken down into few small pieces, and further that is cleared out in the further scan. So this is how, thank you everyone for this patient hearing. And this is my short experience in my clinic uh, at Victory Homeo Specialty Clinic in Bangalore that I've been handling gallstone cases. Thank you. Thank you so much, everyone.
Thank you so much, Dr. Rohit. You have explained in detail from beginning to the case presentation. Really wonderful session, and it gives, I think, the participants, many of the participants will get confidence to treat gallstone polyp, gallstone. I have a question. When you are saying about the triglyceride rates, you have said that those who are using coconut oil, the triglycerides will increase. Is it?
No, not all cases, but few of them specifically I observed in
But
some
you have
families.
noticed that,
No, this I've seen in patients who have started using coconut oil here in Bangalore. People who have
before
been
they don't.
accustomed in coastal areas. So
Uh-huh.
many, I've observed this also. Now, specifically in Mangalore, in Karnataka coastal, they are born and brought up with coconut oil preparations. In such families, I don't see so much of variation. But when I see the coconut oil preparation which people use here in Bangalore,
Okay.
where they have changed from oils to oils, I've seen an elevation in them.
Okay, because the Keralites mostly we are using coconut oil.
Coconut oil. But
Yeah.
I've seen in few Keralites also, but you can check. Some of them will have high elevated triglyceride value. Their LDLs will be very good, fantastic reading. They will have a very good HDL value, but
Yeah.
slight elevation in triglyceride. But try Goteria Gomeri, it comes under control. You don't need to stop coconut oil, but it controls with our medicine. And again, when I treat hyperlipidemia or cholesterol Goteria Gomeri, it's not that the patient has to be all the time on medication. Give 2 months or 3 months, go for a repeat test. Results are okay. Stop medicine. Advise the patient to manage moderate values. Everything will be fine.
Yeah.
And there's
Thank you.
one question by one of the person asking for
From
any
the chat box?
preventive medicine for recurrence. So preventive medicine, like how I was explaining, if there is any variation in our LFT, liver function, or lipid values, or fatty liver, we can give those medicines, our mother tinctures or cholesterol 6. So it helps. And eating at the right time. So diet is very important. So we can probably think as preventive medicines like our mother tinctures like cardosmar, chelidonium, or Gautaria gumeri. So at least the lipids are taken care so that formation of stone is not formed.
Okay, the participants, if you have any questions, means you can raise your hands and I will unmute and you can speak to Dr. Rohit. Anyone have any question, means please come forward. Dr.
Hello,
Ganesh.
Dr. Yes, yes, Dr. Rohit.
Yeah,
It's
good
really
evening. Yeah.
a very good session. And Doctor, what are the precautions you advise to the patients to avoid this kind of problems?
So one thing very important is I advise the patient to know how the type of or the characteristic of the pain happens. And there has to be some vomiting, severe pain. Only then become alert of it, go for testing, then we treat accordingly. And never at a time become panic or think of surgery. Surgery, yes, I agree. I am not saying out of my 10 cases, I may be successful in 5 to 6 of my cases. Another 4 cases, the stone have increased in size, or the stones have not reduced as to my uh, thought process or how I would have anticipated it to be. So in such cases, maybe I explain the patient that let's try to wait, I redo the case, I redo the prescription and see how best we can try to. So many a times I see one scan, second scan, if things are not improving the right direction, I change the whole prescription. Like I told you, sir, like I've used mother tinctures in my cases. So mother tinctures I use for kidney stones also, I use mother tinctures here also. Maybe I can probably learn from others also. I am still learning. I still try to discuss with my colleagues what other medicines or anything else or any others. We learn. It's always learning is the thing. So we always learn. So what best we can or how best I can arrive at the same level. So I've done
Have
that.
you ever used the cholesterol for this
Cholesterol
problem?
I use, sir, very regularly. Like I said, if the lipids are high, I have used cholesterol 6x as a mother tincture. So I have done that.
Sir, whatever the rule of
What is your present success rate in those
So, like I
cases?
said, that's what. So, out of my 10 cases, when I treat my 5 to 6 cases, I have seen good
Yes, yes, yes,
prognosis. So, four
yes,
cases, no.
Dr. Bindu Prasad have some question, right?
yes, 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 sir.
rule of constitutional medicine and anti-miasmatic medicine. Is
Sir,
there any rule?
So can you
sorry.
ask your question once again?
Sir, is there any role of constitutional medicine and anti-miasmatic medicine?
So that's what. So, like now, for example, if we are not getting any medicine in hand or we don't have much prescription, much symptoms, the patient is having only a scan report and he or she is fine, completely healthy. So at that time, whatever best we can get, particulars or physical journals or mental journal, take that totality given and first now what we can use the formula what Hahnemann has given for one-sided diseases. So we can always prescribe an antipsoric. So we can start with sulfur and then probably we can go for an antipsychotic medicine. So probably we can think of calcarea carb or we can think of lycopodium or any other nearby antipsychotic medicine and then go back to antipsoric. So the formula what Hahnemann has given is that first antisora, then psychotic, then again go back to antisora. So we can always use this. I have done this. I have used anti-miasmatic medicines. Now with my current prescription, I give these anti-miasmatics over weekend. So sometimes as my Sunday prescription, I give sulfur or I give calcarea carb in between as intercurrent medicines to as a catalyst to improve the case faster, better. So I have used it, sir. We can use that as well.
Actually, sir, in the both the cases, we are prescribing medicine as a therapeutic one. So and we are treating the outcome. And so, what I am thinking, as per homeopathy perspective, we must treat the case as a totality, considering
Yeah.
as a totality, and there is need of constitutional and or anti-miasmatic medicine even after getting cure.
Yes, sir. Because see, these are all chronic cases. They require constant check and treating them accordingly. But again, I say probably maybe over maybe another few years down the line, over my further experience, maybe I will have that confidence to probably prescribe only that sulfur, only that lycopodium and wait. I can do that. Now I got a near minimum, I have given that. But yeah, I would want to see results faster. That's what I say. It is a doctor's anxiety, which we add extra prescription to make our prescription bigger, better, and you know, foolproof.
Thank
Maybe
you.
sulfur or maybe phosphorus or lycopodium is enough, or arsenic is enough in the case. But we might add. So that's the way it goes.
Thank you, sir. Thank you.
Thank you, Dr. Rohit. Thank you once again because your presentation was excellent and very informative. And thank you so much for being with us. And thank you all the participants. Now it is a time for the Malayalam session.
Right.
So thank you, Dr.
Thank you
Rohit,
so much,
once
ma'am. Thank you, Danesh sir. Thank you, ma'am. Thank you, Sani sir, for this wonderful opportunity in presenting with me. Thank you so much.
So I'm inviting
Before-
Dr. Mariamma John for moderating Malayalam session. Before that, Dr. Danesh have to say something.
Yes.
Okay.
Thank you, Dr. Rohit Srivatsan. And tomorrow we will have a session from Dr. Kripa Rana, and she is the consultant homeopathic and assistant professor in page-taking and repertory at Rajkot Homeopathic Medical College, Pearl University, Gujarat. And the topic of discussion will be Constitution to Prescription, a clinical journey to remedy differentiation. So hope all of you will join tomorrow at the same time. Over to Dr. Mariamma John.